Hello, my name is Chukwuemeka Elendu and I'm a Pharmacist Candidate of the class of 2022, and I'll be speaking to you on the medication Eplerenone Inspra. Eplerenone Inspra is a mineralocorticoid aldosterone receptor antagonist type potassium-sparing diuretic. Indications for this medication include heart failure with preserved ejection fractions, hypertension, primary aldosteronism, and postmyocardial infarction complicated by reduced ejection fractions. This medication is administered orally with or without food. Common side effects include dizziness, fatigue, diarrhea, abdominal pain, cough, and other flu-like symptoms. The mechanism of action for Eplerenone Inspra is through being an aldosterone receptor antagonist. Aldosterone is a mineralocorticoid which increases blood pressure primarily through inducing sodium and water retention. Mineralocorticoid receptors are located in the kidney, heart, blood vessels, and the brain. Eplerenone selectively blocks mineralocorticoid receptors, reducing blood pressure in a dose-dependent manner, and also appear to prevent myocardial and vascular fibrosis. Eplerenone comes in two formulations as an oral tablet in both a 25 and 50 milligram form. Eplerenone is dosed for patients with heart failure, postmyocardial infarction complicated by reduced ejection fraction, and heart failure with reduced ejection fraction at an initial dose of 25 milligrams once daily to a maximal dose of 50 milligrams once daily, as well as hypertension with an initial dose of 50 milligrams once daily to a maximum dose of 50 milligrams twice daily, and primary aldosteronism with an initial dose of 25 milligrams twice daily, which can be titrated to the lowest effective dose, but a maximum dose of 300 milligrams daily. Other serious side effects for patients taking eplerenone include hyperkalemia leading to cardiac failure, postmyocardial infarction associated with serum potassium levels higher than 5.5 and 6, hypertension associated with higher doses and serum potassium levels higher than 5.5, and hypertriglyceridemia that is also dose related, including increased serum creatinine that could also lead to cardiac failure and post-myocardial infarction. In patients taking eplerenone with renal impairment for heart failure, eGFR higher than 50 milliliters per minute has no dose adjustments, but eGFR between 31 and 49 can only be given 25 milligrams once daily, and if eGFR is below 30, it is not recommended. For those taking it for hypertension, CRCL above 50, no renal dose adjustments are necessary, but a CRCL below 50 or a serum creatinine in males above 2 or females above 1.8, the use is contraindicated due to increased risk for hyperkalemia and declined renal functions. For those taking eplerenone with hepatic impairments, there are no dose adjustments provided by the manufacturers. However, systematic exposure is increased in those with moderate to severe liver disease. Warnings and precautions for this medication include hyperkalemia, which may occur, increased risk in patients with impaired renal function, proteinuria, diabetes, and those taking ACE inhibitors or angiotensin II receptor blockers, as well as NSAIDs. Patients should avoid activities that require coordination until the drug effects are realized, as the drug may cause dizziness. Patients should avoid potassium supplements, potassium-containing salt substitutes, and other potassium-sparing diuretics during this drug therapy. Monitoring factors for patients taking eplerenone include improvements in clinical symptoms of congestive heart failure, such as increased exercise workload, reduction in blood pressure, and other safety concerns that need to be monitored include serum potassium prior to the initiation of therapy, within 1 week of the initial start of therapy, after 1 month of initial start of therapy, or dose adjustments until the drug effects are established and must be checked periodically afterwards.